All right.
Good to have you here, sir.
Thank you. It's good to be here. This isn't the Inquisition, is it?
No,
It is?
you're good.
Okay.
You know,
See, I got the audience over there.
I'm like F. Lee Bailey. You, sir, are under the microscope now.
Jerry, let me know when you're ready. Ready?
Ready, sir.
All right, watch the clock.
And Jay Oliver here from 1039 LI News Radio as we continue our Peconic Bay Medical Center walk down memory lane here. Very happy to have Dr. Agostino Cervone, a board-certified general surgeon, director of general robotic surgery for the Peconic Bay Medical Center. Sir, great to have you here.
It's great to be here. Thanks a lot.
Robotic surgery for the Peconic Bay Medical Center. Did you have to go to medical school for that? I would think you did.
Well, I guess, yeah, in order to be a physician and a surgeon, yes, you did.
You didn't have to win like a science project in school in order to kind of catapult you into this area.
No, that was kind of a hobby, I guess.
Yeah. Robotic surgery. Now, do all hospitals kind of delve into that whole robotic type of surgery now?
Well, robotic surgery used to be privy mostly to university or big institutions, but as a community hospital on Long Island, I think we were one of the first to have a robot. And it seems that more and more as time goes on, robotic surgery starts to show up in various smaller hospitals than what we've seen in the past.
Now, is it all about the incisions? Because in reading about this, it enables small incisions to be used to introduce miniaturized instruments, which is incredible when you think about it. And first of all, let's go back a little bit. Let's tell the folks exactly what are we talking about here. Robotic surgery is?
So robotic surgery is operations that we normally would do, and I guess most of us do things minimally invasive using laparoscopic instruments. The ability of having robotic surgery is it's still minimally invasive surgery, but some of the instrumentation, some of the fine, delicate dissection, some of the visualization, because it's 3D and high definition, is much improved. You know, everybody has a little bit of a shake in their hands as they go along, and some less than others. And as mild as that tremor may seem as we're doing things in the operating room, there is absolutely none of that with the use of robotic surgery. The other advantage is the instrumentations of the robot. The main advantage is the wristed instruments. And you might say, well, what do I mean by that? So if you put your hand into a container, if your hand was only fused to be straight, there's only limited things you can do. You may not be able to reach into a corner or so forth. Whereas with wristed instruments, you can kind of flex the wrist and kind of get into little corners or around things. And that's probably one of the main advantages of the robot.
And, you know, looking at some of the procedures here, laparoscopic surgery, single incision laparoscopic surgery, hernia surgery. So in essence, in the old days, I remember my dad had a hernia surgery. Pretty much it was a large incision, and then all of a sudden, okay, he's walking around with one of these 12-inch scars here. When it comes to robotics, though, we're talking about small incisions now, and small incisions with this type of equipment, you can still do the same job, if not better, I would think.
Oh, absolutely. So yeah, everything is with smaller incisions, which kind of translates into less pain. But you get it to the point where, as you refine your techniques in reference to hernias, as you kind of started out, you can get it to the point where you can get patients back to work earlier, back to their normal activities, to the point where I will tell them, I will leave that up to them, how they tolerate the pain. I'm not worried that they're going to do anything to interrupt what I've done in the operating room.
Is it less, it's got to be less recovery time, I would think.
It is.
Robotics, correct?
It is. It is less recovery. Whether it's minimally invasive laparoscopic versus robotic, the recovery period is certainly much less than what it was traditionally with longer incisions.
What are the most common types of robotic surgery? What's the #1 procedure that you would use robotics for?
So what I use it most commonly is with gallbladders, just through the belly button. So, early on in 2008, we ventured into single incision laparoscopic surgery. The difficulties there were the instrumentation. And now with the use of the robot and the type of instrumentation that they have, we're able to do what we would do laparoscopically now through a single incision, having no difficulty at all in terms of doing the dissection.
I would think also less cause for infection as well with this type of surgery.
Yeah, I mean, the rate of infection with laparoscopic surgery is low. But it's one incision in reference to that compared to 4 incisions traditionally with gallbladder surgery, laparoscopic gallbladder surgery.
We're talking with Dr. Agostino Cervone, board-certified general surgeon, director of general robotic surgery for the Peconic Bay Medical Center. Also, interesting, skin lesions and cysts. You would think also this would be an excellent use of.
Not so much with the robot, but just as a general surgeon, as a practicing general surgeons traditionally do bread and butter hernias, gallbladders, colons, stomach, lumps and bumps, breasts, things like that. All soft tissue anatomy as opposed to bones and orthopedics.
Is the advancement such now where we're going to go beyond the gallbladder and we're going to go beyond the hernias? Are we going to delve into some really serious stuff? Is it possible, as technology kind of makes its way to that point, that we are able to kind of use robotics for very, very tough procedures?
Yeah, I think the evolution of robotic surgery is still in its infancy, meaning that as time progresses, we'll find that there are more uses, and I think it's going to be more directed towards a single-site robotic surgery, meaning going through the belly button, basically. And for now, it's FDA approved for gallbladders as well as hysterectomies. I think as the robotics and the instrumentation improves, you will be able to do pretty much anything. So picture maybe a 2-inch port that goes into your belly button, out from which comes these little snake robotic arms. And it sounds medieval or crazy, but these are all controlled by the surgeon at the bedside. And with that, you can turn any direction in the abdomen and do any operation that you would otherwise traditionally do through an open incision with your hands. But now you have the ability to do it through this small incision robotically.
That is amazing. That is unbelievable. I mean, we're in the 21st century. We're talking about robotics. I remember years ago, it wasn't that long ago, my wife had the gallbladder out. And I remember it was 3 incisions, pretty much, within the belly button area.
Right.
And all of a sudden, bingo, you're done. And she might have went home that very same day. She had the surgery done in the morning. And that's possible, too, to go home that same day.
That's
correct?
Traditionally, that's how we do it. Yeah.
I mean, nobody really can. I mean, traditionally, with the old type of surgery, you're there 2 or 3 days, you're eating the rotten food and everything else. You're having fights with the nurses, and all of a sudden, you don't never want to come back. With you, you've done a couple of robotic type incisions.
Well, the nurses are nice at Peconic Bay, but yes, hopefully you're not fighting with anybody. But yeah, I mean, I remember my mom having her gallbladder out through a traditional long incision, and it was 6 days before she got home, and probably months after that before she recovered. So certainly, the advancement of minimally invasive surgery was a stepping stone to solving that, and I think further on along that advancement is robotics.
Can we get better as far as the equipment? Do you see the technology advancing to the point where, you know what, we're going to get another model here of robotics? Can you see that in the future, or have we kind of hit it here?
It's easy to say from here what we've hit and not, but I see for right now, at least Intuitive, who makes the only FDA-approved robot in the United States, has said that all their future of robotic instrumentation will go along that platform, the SI robot, of which we have. But yes, I do see that there are probably advancements in the instrumentation, but at some point, it's going to be obsolete. At some point, there's going to be something else more than that. Yeah.
Here. What about as far as timing is concerned in an OR? Obviously, years ago, you had the hernia out, the gallbladder out in a traditional way without the robotics. I would imagine it was probably maybe a 2-hour operation. I don't know. I'm just guessing. But maybe with robotics now, it's such a time-saving type of deal that you could do more of these in a given day, and I would imagine help people move along and get to the next one and the next one.
Well, contrary to that, I think when surgeons first start out with robotics, their time is a little bit longer, and a lot of that has to be involved with getting things set up with the robot. It's not so much the procedure is longer, but setting up and taking down the robot. I've got it to the point, and as most of us who are doing robotic surgery have got it to the point where it's at least the same amount of time as if we were doing it laparoscopically. And then as it further goes on, I'm actually doing them shorter sometimes than doing them laparoscopically. So ultimately, yeah, I think that that can be true.
You know, I kind of look at you like maybe a kid with a PlayStation. And you see these controls, the way they kind of operate, and believe me, my kid would put me, forget it, at a commission playing any type of game. I would have to think you, as well-versed as you are in these types of robotics, it's almost the same correlation, no? I mean, you know it like the back of your hand, pretty much.
Yeah, I mean, there is a hand-eye coordination, and studies have shown that if you played video games, you're probably better off at doing some of this stuff. Doesn't mean that you can't learn the new tricks, but yeah, there is a bit of that.
There's a lot of skill involved in this. Come on. I bet you are a killer when it comes to like Pac-Man and everything else and all those other games.
Yeah, it was more some of the other video games.
Come on now. We're talking with Dr. Agostino Cervone, the board-certified general surgeon, director of general robotic surgery for Peconic Bay Medical Center. More to do, more to discuss, interesting stuff regarding robotic surgery. We'll be back.